to Escaping Dystopia. Tonight is episode 94. Today is March 29th, 2020. The wave builds. We'll take a couple minutes here, let some folks show up. Last little while we had been previously doing our little face thing. Maybe we'll keep doing that because it's a good way to kind of break the ice, or kind of ice-breaking segment. I guess that kind of works for this kind of thing. For when I repost, I guess it's not live anymore, not nearly as interesting to watch me ramble on. So I don't know, we got to figure out how things go. I'm having some fun with it. But yeah, this is week 2 in the basement. We're always coming to you from the basement, but we've been in the house. This has been week 2 of our, not quite a quarantine here. We haven't had any known exposure or anything like that here in the house. But Colorado's been on a company that I work for, has been on a couple weeks now, so we haven't really been out of the house much. At least for any social interactions or anything like that. We're going to have to see how this is all going to play out over the next little while. Let's get started. Spaceship Earth. I'll tell you what, I think we're coming apart a little bit. There's been, it's been really interesting to see how this is going to play out, because now the virus has moved, and there's been, the way that it's been flowing around the world has been kind of by connectedness first, and that's what's happened here in the U.S., where the places that have been hit the fastest have been the places that are most connected, right? You have, originally in Washington, that outbreak was connected to some folks who had actually gone to China and tried to do some early treatment and then came back. Then, of course, you have New York, L.A., San Francisco, all the big coastal connected places, Florida now as well. They have a cruise line coming back now, trying to dock in Florida, that a number of people have died on already, and I guess there's a number of 100 or so sick people there. So that connectedness has been the first places that have been really hit outside of the original zone. The way the U.S. has responded has been, of course, atrocious. We'll talk a little bit more about that later. And so that's why we're in this different mode now. But that's what's happened, and it hasn't really hit the big population centers outside of China yet. And I'm talking about some of the Malaysia, Indonesia, the Philippines. That's where it's actually hitting now, where you have these much more densely populated, lower income areas. Once it starts to hit the refugee camps in some of the places in Syria and on the border of Turkey, you're going to see what I'd call the true mortality rate, which is what happens when people can't get any kind of real medical care, and this thing goes critical. What we're seeing again here, the same kind of numbers that we've seen in other places, that it takes a few weeks for things to progress, and then people start to call the emergency room after a couple weeks, and that's when you start to know how widespread it is. Because of the lack of testing, there's been no real sense of it. Even though the U.S. is now the highest number of confirmed cases, with the number of deaths we're seeing at the timeline, the estimates are that the actual number of cases was 10 times that. So what's interesting about that is you have that 10 times that, and then you have that percentage of severe cases. And this was kind of the numbers I was looking at and using early on, was that the number of cases we were actually seeing were not total cases, but indeed severe hospitalization cases, people who actually got tested, people with more severe symptoms. Anyway, yeah, but it's one of those things too, but being not connected is not going to stop this, and that's the thing. It's just going to slow it, so it's going to give you more time. And you're going to see that here in the U.S. as we're going through the big cities first, and then it will, converge and spread out. And not being connected, again, isn't going to protect you. We're going to see over the next couple of weeks a little bit more of the panic stuff kick in. There was a order, and we'll talk more in detail about these in a little bit, that didn't happen for New York City over the weekend to lock them down. But let's get started on the big point, one of my big points. The name of the show is Escaping Dystopia. I started this because the U.S. was flirting with this idiot despot, and then we put him in charge. And one of the things that I had always feared from the get-go is that there would be a situation where we would need a single point of information, where the country would need a leader. There would be new information that only one person would be the font for like a big crisis or a war or something like that, and the country would absolutely have to depend on a compulsive liar for that information. And that situation has now presented itself exactly. And this is what I wanted to avoid completely the whole time. Right now, the president has a daily outlet to attack all of his enemies, including the press, and it's a press that is the ones who are bringing this information out to people. So, kind of how the virus itself uses the human body to spread, right? This stupid virus is using our media to spread. And it's attacking the media in and of itself, and things that were said 2 days ago or things that were said in other places. Like if he said something on Fox, you can't bring that up when he's talking to the nation because that's for Fox. Those were for Fox people. So he can go on there and say one thing, but you can't say or ask him about that on the other side. That's the dynamic that's happening now, and this allows him to both attack his enemies and use it. And the narcissist coin here, right? And I've mentioned this before, but the narcissist trick is pretty straightforward. If something bad happens, right, it's not their fault, and it's unfair to blame them for it. If something good happens, it's unfair to not give them credit for it. And that's what we're seeing now. And just this constant dynamic and having this bludgeon where you also have a nation that's starved for information and a situation that changes every day. And so we need new information. We need updated information. But the person who we're most depending on to provide it for us is a compulsive liar who is using this as a campaign tactic. The daily briefings are not worthwhile to watch because whenever they show them, they later have to be like, oh, well, you know, he said this, but that's not true. We talked to these people, that's not the case. He said that this was going to happen. It's not happening. Widespread testing at CVS, you know, various treatments that he's talking about. And he lies about this constantly. And people can't even ask him about numbers. We'll talk about that a little bit more. But this was precisely the situation that I was hoping we could avoid. And I'm going to talk a little bit more about why, the dynamics that this creates. But the poll numbers now, and people are showing that, and we're having that kind of rally around the flag effect. If you're kind of flabbergasted by seeing some polls that are showing him rising in popularity, I don't think that's going to last for a couple weeks. I don't know if this is enough to break his base, other than just in the very crass way that so many of them are going to be sick quite soon. Considering there was a number of governors in the South, Ivy, and in Alabama, I think, and I don't know, the other one, I don't know if it was Tennessee or someplace else. There was a lot of state information this week. One of them overrode the kind of the stay-at-home order, and the other is also downplaying this. There was a big church service in Florida with like a mega church today. The only way that we stop this from getting totally out of control is through these social distancing methods that we've been using. We're still learning about how the virus spreads, how contagious it is. There was a good paper I read this week on how long it stays on surfaces. You may have seen some of that. And it's, you know, viable, is what they say, for up to 3 days in some situations. But whether or not what the real world that looks like, it's a little bit different than what they've shown in a lab. And translating lab results to real world is not something that, in this case, I feel particularly safe about doing. But there is some sense that, you know, the virus does stay on surfaces and can be transmitted that way. The mask situation in the U.S., I have to see a little bit more about this, and I'll probably do another show next week, but I'm not sure that we shouldn't all be wearing masks at this point. And I think one of the reasons why a lot of the Asian countries as well particularly have been doing that more is because of their previous experience with these SARS type diseases, with the respiratory fatal that have happened over the last 15 to 20 years. So I think there might be a little bit more kind of cultural useness to that. I mean, it's more regular, but I'm starting to think that that might be something that we need to do. We'll see over the next couple of weeks how this is going to happen. The president came out today and apparently said, "Who said Easter? Nobody said Easter. You said Easter. You said Easter." And we're not going to open up for until at least the end of April. So April's going to be a whole long, slow grind. But I would not recommend watching those daily briefs. Find a different source of news. I know it's, everybody's kind of stuck at home and there's a lot of media to watch. But it's really unfortunate, but I can't recommend that because it's just not a good source of information. Moving on to the update itself for this week. So these are some of the numbers as of today. Deaths are over 2,000. Cases are over 100,000. The U.S. now leads the world in cases, and not deaths yet. Although there's a decent chance at the rate that we're doubling a week from now that we could be looking at 10,000 deaths. There's a number of cities. I want to talk about this because this is a little bit more serious, and I want to make sure that for posterity's sake and for history, the lockdown that we're seeing was not necessary. It was a completely inept management of this crisis from day one that has led to this. And because that inability to test and understand what was happening and not trying to even contain it, because somebody got some really bad advice or somebody was just an idiot at some point and thought, we'll just let it come in. Not that many people would be like, the flu will be okay. It's going to take down China, but we'll take it. We got the hospitals. We'll be fine. It'll pass, and then we'll go. It'll be like nothing ever happened. Again, you can see this in the words that he said. That he thought it was going to come and not be that big a deal, and then just go on, and we'd be fine. And he said these things. But because of the general vagueness of the way he does it, because nobody ever holds him accountable for the words that he says, people didn't put it all together, that he was hearing these reports and just dismissing them. And now, of course, the gaslighting is coming every day in that press conference, how nobody took it more seriously than me. It's a lie. A big lie. So anyway, understand that the lockdown that we're experiencing now, what we're going to go through now, was a containment failure early on. And I talked about this months ago in freaking January, when China sacrificed Wuhan and said, all right, we're going to shut down everything, close it all down, no one in or out. I was like, holy cow, they're doing this. This is a huge hit to their thing, but it sure probably might save the country. And that's what they did. We are not doing that at all. And it is here and worse than it was there. Right? And so they were talking about today doing a quarantine on New York and New Jersey and I think Connecticut. And they backed away from it and said, just don't travel there. Everybody trying to do these travel advisories, which aren't going to work at all. And one of the reasons why that they talked about it too, trying to do the lockdown, because then you have to have law enforcement enforcing the lockdown. And then you're creating another sense of panic and more people who should be trying to help, right, and building hospitals, now trying to direct traffic and trying to stop people, and then there's guns involved everywhere. And now all of a sudden you have a whole nother level of thing as you're trying to enforce your will upon a populace that does not trust the government. And in fact, like I was saying, the only people who actually trust Trump are people who hate the government. As an ideological standpoint. I'm from the government and I'm here to help. Those are the scariest words in the English language. That's part of the ideology. And that's what we're dealing with right now. So this disaster is just starting to unfold. This last couple of weeks is when it started to become clear that this was happening. What's going on in the cities, they're probably, a number of them are going to have some issues this week. And this is one of the things, this is why these ventilators are now becoming a thing that people are talking about, and respirators. Because one of the things that happens when people get really ill and go to the hospital and go into respiratory failure. Respiratory failure means you cannot breathe. So you have to be put on a ventilator, which breathes for you. And then your body tries to fight and you stay alive. But the thing is, that takes weeks or days or more than, or weeks and then doesn't work. And so that's how difficult and how dangerous this virus is that people who have those kind of complications and get to that point they don't cycle through. You don't spend a couple days there and then you're gone. You spend a couple weeks and then maybe you will have died. And as those start to fill up with these serious cases, that's where things started to get really nasty in Italy. Is where doctors had to make those decisions on, all right, I have one ventilator, I've got 7 patients. How is this going to work? And one of the things too, and I need to remind everyone around this because this is what it's so hard about this. The fatality rates continue to hold pretty steady, and that most of the people who are at risk of death, of mortality, are older, much older, in the 70s and 80s and more. And you definitely see that, and I've seen that going out, and the seriousness with which other people are taking this. And that a lot of younger folks, and again, there are those who have had issues, but normally younger people who don't have health issues are not at a big risk for this. And they're not, many of them are getting sick, and many of them are getting very sick, but if they have that ventilator access, they're not dying, and they're recovering. But if we move to a point where we don't have that medical care for even, the middle-aged 30, 40, 50 folks who get very sick. There was a woman here in Colorado, in Inglewood. Their whole family got it. The kids got, kind of a little cold. Dad got kind of a pretty bad flu, as it were, so to speak. Mom ended up in the hospital. And they were one of the first people around the area to get it and move through. And so that's what we're trying to avoid, is that spike, that we're going to see how big that spike is in these next 2 weeks. And because of the incubation period, and because of not only the incubation, but then you have the asymptomatic transmission, right? Those people who have no symptoms, but are still walking around transmitting the virus to other people who might then spend 2 weeks, right, building it up, and then spend 5, 6, 7 days getting sicker. And the way that we're dealing with this across the country is you're not going to the hospital until you are very ill. And that's where this wave, that's what I'm talking about, this wave coming. And it's hitting the big cities now, New York, New Orleans, Detroit, Atlanta. These are all places, Los Angeles. These are all places that in this next week we expect to see the hospitals fill up and then moving to a more desperate mode. And I don't want to scare people in the sense, if you're watching this and you're not in one of those places, the whole idea here, when even this was in Italy, was to listen and change your behavior in a way that helps avoid this wave blowing us away. And it's one of those things that's so difficult too, because one of the things that sucks about pre-planning and being overcautious or doing that kind of stuff and making sacrifices before the thing hits is that if you do it right, and if we overreact, or if we do it, then the wave doesn't hit. And then you have to deal with, we did all this, and man, nobody even really died much. And it was like, yes! That's what we're shooting for. I don't think we're going to see that. And I've seen some of the estimates, and Dr. Fauci, IAS, came out today and finally told people what it's going to look like. Because this is what I've been saying for a while, because they've been acting like it was nothing, and I'm like, no, a lot of people are going to die here. Look at these numbers. They don't... Because I've had some friends, I've had some other people send me some other data stuff, and as you look at the number of cases, the number of people who are sick, if you compare the number of really severe cases that we would see, then you see that the number of cases we actually had weeks ago, right, was much higher than what we were saying. But then if you see that it was much higher than what we were saying, when you start with a much higher number, exponential growth of a much higher base number goes up much faster than exponential growth of a lower one, right? Goes a lot faster. So where we are, I think, is quite a bit ahead of where people think we are. And some of the projections I've seen, and a particularly good projection that I think is wonderful because it takes into account hospital beds and some of this time to recover and things like that. And this has the projection for the U.S. of slightly under 100,000 people. Is undercounting Colorado by about 3 times currently. And Colorado's not supposed to be at the place where it is now until this projection says for another 5 days, which is nearly another doubling cycle. The Colorado government has been really good about this, trying to show people what the differences are in our actions. And we don't have, 5 different worlds to play with where we can say, well, on this one, let's all just act like nothing's happening and we'll see how bad it can be. Oh, and here we'll be like, let's treat it serious. we can't do that with our different worlds. And so after the cities, and this is the thing that's going to be tough too, because over the last 10 years, again, we've lost a lot of rural hospitals and a lot of support there. So if people think that they're going to be able to run and hide, even then, if you get sick and you get really sick, you have to go to the hospital, and you want to get good care, and good care happens in the cities. And so even then, you're going to be coming in on the tail end of this and having that difficulty too. So the wave is going to, like a tidal wave, it doesn't really crash and recede. It crashes and then there's a flood. So again, we're trying to deal with this. Some red states aren't slowing down, and it's going to take 2 to 3 weeks for people to go from exposure to needing a hospital. So again, as we move towards the end of this next month, we'll see how bad it's going to be in some of the really rough places. And then also, and I think of Mississippi and Alabama, Louisiana is getting hit right now really hard because they had Mardi Gras. And they weren't told not to. And that's kind of the excuse that they're using now is, oh, nobody told us not to. Well, maybe next time. So it looks like the president really did want to quarantine New York and shut it down, and he got talked out of it, realizing that it would set off a bigger panic. And because if you start to do that and people start to realize that this is an option, that they have to get out before they get shut down, then they start to run. And we want people thinking. We want people calm and relaxed, chilling in their basements, right, at their phones, right? Oh yeah, and then this week the stimulus was passed. They passed a $2-point-something trillion stimulus, which again they're going to blame. And I'll tell you, well, it's actually going to be two things. If the president's reelected, then there will be no blame until a Democrat is elected, and then the Republicans will be like, oh my God, you spenders! But anyway, they needed to do this, in my opinion, like I said, previous shows, a month ago, so we could have had this money out, so then 2 weeks ago, we could have told everybody to chill out, and everybody would have shut down and been happy with it. They'd have had money in the pockets. We'd have been able to do this in a more orderly fashion. Because we have not been able to do this in a more orderly fashion, my guess is it's going to be quite bad and go on quite long. If this gets totally out of control here in the U.S., and it starts to become clear that the U.S. is doing way worse than a lot of other first world countries, there will be a lot more people that start to cut us off, and this will be China starts to step up and replace us in the world stage. There are a number of third world countries, I think, that are going to be absolutely crushed by this, including, this might very well put Brazil back into it, as their president is flat out calling it the flu, like a little flu. And this is after people in his entourage got sick. So it's going to hit Brazil like a ton of bricks. We'll see, though, because I guess it's actually moving in late summer there, so they might be seasonally helped. But if it then takes off and is there through the winter months, there, right, through our summer, and then comes back around November and comes another wave, and then we have the situation where some of the research is coming out, and I hate to be the bearer of bad ties, but coronaviruses are not unknown to our species. A number of them cause regular colds, and this is why people have been like, oh, it's just a regular cold or a flu. Yeah, well, they have coronaviruses that do that. And you know how you don't build up an immunity to the regular cold? Have you built this? Have you modeled this out before? Part of that is why we do actually get immunity to the common cold, but it, A, doesn't last forever, and B, there's lots of them. So one of the things that we say, that you can pull out of that is, yes, we do build immunities to coronaviruses, but no, they don't last forever. So again, this is where the science and research and understanding of what we're going to have to do to really get control of this, if this ends up being just this nasty disease that just keeps coming around and keeps coming around, and you just get it every couple years and hope that it's not that time. Meanwhile, every time it's coming around, 20-30% of everybody over 65, you can see how this is a real thing. and how it's a global changing thing. Now, to bring this to the next point, this is why the President of the United States has to lie constantly about this. This was the danger, right? This was the problem, that we're going to face a real big actual thing and have this idiot in charge who doesn't know how to deal with it right and make it wildly worse. One of the things that he started about, he's going to lie about a lot of things. And this is where having somebody on there every day who is using this as a self-serving platform is so bad. Lying, got to keep them low. I think one of the reasons why testing was so low early on and why they didn't take testing from other countries, because he wanted to keep the numbers low and thought that he could, and thought that by not testing and then people would just kind of get the flu, they'd get better, you wouldn't even know you had it, da-da-da, double-doo, and then we're done. I think that was an actual strategy. The deaths. I think this is going to happen in a number of ways. And let me give you a quick example of this. There was a hurricane a few years ago in Puerto Rico. I think the official death toll from the hurricane itself, which is I think just people killed by wind, was like 17, under 20. The number of people who died because the power got knocked out, because the response was so bad, who would not have died otherwise, was in the thousands. And so this question is going to come up, and you will see an official government number that is people who died directly of this COVID-19 disease, which, because in many cases it's not what's killing you directly, but it's allowing other pneumonias to come in. I don't know the technicalities of it, but if they find some other pneumonia as the cause of death, you're going to see some really weird numbers. And also the problem too is, in order to get that designation, if a sample has to be sent through the CDC, tested and confirmed, and the CDC is understaffed for the next 2 years, you're not going to get those numbers. And so I'm really, really concerned that the numbers of people who actually die from this are going to start to wobble and start to change, and then the gaslight is going to go at them. So there's enough people doing good data stuff now that I think you'll be able to see that. But again, it's hard to break through when the most loudest horn in the room is telling everyone that you're a liar. That's what the media is trying to face right now. Economic impact. Did a short video earlier about the stimulus checks and how the president wants to have his signature on all of them, so all of his supporters can claim that he personally has sent them checks to help them keep going through this whole thing. This is part of the legend that he's built up in their minds, and it is real. This is one of the things that will make this election quite interesting. He wanted the states to delay their unemployment numbers. You're going to see them try and do that, some of this. There was 3 million unemployment claims this last week, roughly a 5- to 6-fold increase over the highest number ever. That's a tenth of what's coming. Again, this is one of the things that had we had the legislation in place and ready to go, had the economic stimulus done weeks ago, you could have said this, you would have not been actual unemployment. So you would say, you know, don't file unemployment. This is corona employment. What you're doing now is you're being employed by the state to stay home. And that's how you do it, right? And you get ahead of it and communicate to say, hey, this is what we need y'all to do. This is why we need you to do it. This is how we're going to do it. Here's some cash so you can do it. So you can do it right. And instead, we're trying to catch up to all of this, but we're 2 weeks behind something that's 3 weeks ahead of us. And so we have that month of lag time. This next April is that month of the whip cracking. So just get ready, folks. Saying. It's going to be a rough month. Responsibility. He's already denied responsibility for any of this. So I mean, when somebody says flat out, now I don't take responsibility for things that I did, there's not really much you can do with that, other than be like, well, yes, it is. As the death count grows, he's going to re-emphasize his lack of responsibility for any part of that, and will blame everything and everybody he can. This is actually one of the things that he was trying to pin on China earlier. And this is one of the things that I think why he stopped trying to blame China. Because I think China, Xi, or somebody called him and said, if you keep doing this, we are not going to help you at all. And that's one of the things, because a lot of our PPE, our personal protective equipment, you've heard that acronym a lot, comes from China. And I mean, they sell like half of the world's stuff. We actually have a decent market for it ourselves, but again, we're way behind on this. Today, in the President's Live Fest, oh yeah, man, I can never remember the you guys can hear me. Today, in the President's Live Fest, he tried to blame some lack of medical equipment on the medical professionals who are on the front lines fighting this battle, saying that somehow boxes are disappearing out the back, like some sort of mafia style, and they're selling them themselves on eBay. And I don't doubt that Fox or some other source will probably find that this has happened somewhere at some point. This is truly some of the more despicable things that I've ever conceived of in this kind of situation. And the reason why he's doing that is as an excuse so he won't be blamed for the lack of equipment. That's it. And he's so obvious and clear once you see how he does this stuff. And then you have this credit extortion racket where he's going out and saying, well, that governor wasn't too nice to me, so we're not going to send them any ventilators. And that one, oh, yeah, he's great. He says I'm awesome, so yeah, we'll help them out. And again, this is all for the re-election campaign. That having them say that he did good, whether or not he did good or not, it's important for them to say that publicly. You need to go on the media, you need to say this, and then I'll do it. And that is the exact same thing that he got impeached for. And to claim somehow that he would never do that kind of thing when he's literally doing it now, again, full on, illustrates the problem with having somebody like this in charge at a time like this. So he has to lie, and this is why he must. Why? Because somebody is going to be blamed. It's just the way it works. The idea that people are going to blame the virus, right, is to a certain degree correct. That was why he was going to call it the Chinese virus, so people would blame the Chinese. But now, like I said, I think somebody got to him and said, no, that's not going to work, and that's going to bite you back in the ass. Yeah, sorry about the microphone thing. I'm horrible about doing stuff. Dang it, Roy. I'd go back and do everything, but I can't remember anything I said, so I'll go over some more of it again later. But he has to lie, because the weight and the burden of what's about to come, one of the biggest disasters in U.S. history, is going to be huge. Democratic primary. A little fun time, happy stuff here. I'm at the point where I'm pretty much on the Bernie bandwagon. I would say a word there, but I think I want to promote this video, and if I cuss, I can't. But I'm on the F that guy bandwagon. Apparently he's going to try and keep campaigning, even though the rest of the primaries are being delayed until June or more. Let's see, April, May. What? No, you're not going to win, Bernie. Get out. You're just being a douche now. And this is the thing that sucks absolutely about this dynamic. Because on the one hand, you have the President of the United States out there on TV every day doing his damnedest, right? Whatever, to fix the problem. And he has all the power out there, and he has all the professionals working and doing it. And all the governors doing their good thing. And the governors are doing great. And a lot of governors have actually gotten really high marks around this. And what people want in the crisis ultimately is results. And they don't give a shit about the rest of it. Dang it, there goes my thing. So they just want results. And having this whole dynamic where you've got Donald up there every day surrounded by experts trying to help everything, and then Biden and Bernie like banging it out, is going to be horrible for Biden. Just horrible for him. And the dynamics of that are really bad. And when you're doing that, trying to beat the guy, and then you're also having this other guy beat up on you, even though everybody's already decided that they don't want the socialism, not right now, and people are like, oh, well, we're doing socialism, do that. It took a pandemic to get these ideas, and these ideas are only for that. And you say, oh, well, we'll just have government, give us money forever. That only comes if you also are under lockdown. This is not a normal situation that you want the government to continue to mediate. So don't try and build government around pandemic. And if that's your argument, is that, oh, well, the government pandemic says that we should be doing this all the time. He's like, no, we shouldn't have pandemic all the time. I don't know. I don't like the way that this dynamic is shaping up. I don't see that Bernie is listening to anybody, right? Because somebody has hopefully talked to him at this point and told him to stop. But that's the thing too, and about it's made clear that Bernie might be very much one of the worst politicians in American, at least this century, right? Even this century is pretty short, but in the last 50 years or so, might be one of the worst politicians. And I think and the reason why that might be is because he's not a politician, right? He's a populist and an ideologue, and that's why he attracts that kind of burn it all down mentality in that group and those bros that are so nasty. And that's why he's so ineffective at building coalitions, and why none of the people who have dropped out, despite having worked for him for a long time or worked with him, have endorsed him. And they all endorsed his opponent. So that doesn't really work. Not for that kind of stuff. Final note. And I lost my, I didn't have the mic on earlier, so I will cover this real quick. But stay home. It's going to be a while. And this is the thing, too, about what we've seen so far from around the world. With the Wuhan-style lockdown, it took them about 2 months to really get a handle on things. And what that Wuhan-style lockdown means is that's a lockdown in your house. And if you're going to pharmacy, groceries, what else? Why are you leaving your house? They would give you a card, they'd punch it, and then you couldn't leave the house for 3 days after that. I think even for walks, I think it was pretty harsh. And now they're opening back up in the next week or so, or trying to, limited sense. We're going to get a sense here too about that reinfection rate, and if there is one, and if people can open up, and what happens then. Over the next few weeks. The next month here in the U.S. is going to be very rough, I think. And it's going to be, and I've talked about this before, and it's going to be very different, because people who are staying at home and seeing nothing of this and aren't connected to the hospitals or where people are dealing or fighting this virus, you're not going to see it. And you're not going to see the battles that are fought. You're not going to see the war. And it's going to seem very odd to continue doing this. I hope we get some guidance on masks soon, and if we need to do that. The way that, again, the number of cases that we're seeing now at 100,000, right, and we're still doubling every 3 days, 3 to 4 days, right, and that's not that far. I mean, that's, again, a month and a half out from everybody getting it, right, and I've gone through this before, but, you go from that 100,000, 200, 400, 800, 1 million, 3 million, 6 million, 12 million, 20 million, 50 million, right? 100 million. And you're there, and that's 11 of those 3-day periods. And so that's where we're at now. But the idea before was that with the deaths we're seeing, our actual number of cases was 10 times higher than that already. So we'll see if that massive exposure, how much that's going to get to us here. And even then, some people are like, well, then everybody's already been exposed, so let's go ahead and get back to it. And it's like, well, no. Not everybody has been exposed yet. the thing that's tough to really wrap your head around, and I've struggled with this too, and you see this sometimes at mass sporting events, which of course aren't happening right now, but understanding and really grasping those large numbers, and that sense of, 5% out of 10,000 people, and how many that is, right? And when you expand that to 1 million people, or 2 million, or 100 million, and just getting a sense of just the overwhelming waves of numbers, and you don't see it sometimes, right? Because we're so spread out now, everybody's in their homes, but those numbers, they're real, right? And the people out there are real. And as these statistics start to roll in and people start to go into the hospitals because of their sickness, they're real. And it's hard to grasp sometimes because they're so big, right? Billions of people out there, millions of whatever, and even and you go to a big football game and there's 100,000 people there, right? And even if you were to sit down and spend, 5 minutes saying hi to each one of them, you couldn't get through that whole place in your lifetime. But that's just the people, that you can look at in an evening, right? And so there's so many people out there. And when you have a virus like this that operates on just a different biological level, right? That looks at this, at us, not as, it doesn't have eyes. I can't look at anything, but to just feel through the world where these, at that level that we're, like a universe to it. We're a galaxy to the virus. And it's exploring the universe right now and just going everywhere. And it doesn't have a concept of, of anything at our level. And so it's a fire that's just burning through. And we have to find the weapons to fight it. And we need the time to build those weapons. And we do that by staying apart. So, to reiterate, everybody, thanks for dropping by. I appreciate it. It's nice for me to be able to get some of this stuff off my chest and just really lay out these arguments a little bit. I need to do some more editing and stuff to help get a little bit wider audience, I think. But better lighting. Isn't that way better than like this fisheye? Anyway, and I got the microphone on about like 2/3 of the way through because I'm just bad at this. So, I hope everybody can stay strong this week. It's going to be a tough week. It is going to be tough. I think we had kind of that, that shock week and then a little bit of silly fun week, and now people are going to be sick of it. And ready to move on, and it's just going to be, April's going to be a month. April 2020. And so I think for difficult things, I know, especially difficult things that you can't avoid, right? Because like things that you can procrastinate on, like you can make those, the more you can worry and anticipate those that you can procrastinate, that actually will push it back. But for things that you cannot procrastinate on, for things that are absolutely coming, like next month, to know beforehand that they're going to be quite difficult is helpful, right? Other things like a task that you can do whenever, just to think how hard it's going to be, it's going to make you just want to put it off more. But this is coming. The wave is coming. It's going to be large. It's going to be difficult. Please stay at home. Help where we can. Look for those places to help. I'll see you guys another week maybe. We'll see. But let's get ready for this. And stay strong. Peace out. I love y'all. Hopefully we can keep chatting.